touching in a bit about World Health Day, of course, what we talked about earlier. We are actually going to be talking, not exactly World Health Day, but related. So we're going to be talking about tonsil enlargement and obstructive sleep apnea. And I remember on the show previously, we have talked about sleep apnea. A little bit about sleep apnea. I know there are different types of sleep apnea, but we're going to be touching in more in depth about obstructive sleep apnea. Of course, we are definitely not experts in this. Yep. I have no input on tonsil enlargement, and unfortunately. So we actually do have Dr. AHMAD KUSYAIRI KHALID, consultant, otorhinolaryngologist, UITM Private Specialist Centre. Hello, doctor.
Hello, Irene. Hi, Nabil.
Hi, Doctor. It's good to have you in the studio today. And of course, we'll be talking about tonsils. And when we talk about sleep apnea, the first thing that comes to my mind is when you actually be snoozing loudly in the middle of the night. So let's get into right into the middle of that. Maybe you can start with telling us what is tonsils and what is the troubles that usually people would have with this.
Right. So firstly, thanks for inviting me to this session. So tonsil is actually a lymphoid tissue. It is a tissue that helps us to fight infections, especially in our early years. And then when the bone marrow overtake the role to protect or to make the defense for our body, the tonsils or all these lymphoid tissue are redundant already. They don't have any specific function after that. So we have, if we say tonsils, all of us will think that it is the tonsil behind of the mouth. But actually in head and neck region, we have a lot of tonsils.
Okay.
So, but the most common that causes trouble is the one at the back of the throat. So that is what we call palatine tonsil or the throat tonsil. We also have adenoid tonsil at the back of the nose, tubal tonsils near the ear, and also lingual tonsil at the back of our tongue. So all these are same lymphoid tissue that serve the function as I stated before. So of course, during the early years, because it is functioning before it became a redundant tissue, during this time the tonsil usually enlarge. It's like you're going to the gym. You go do a lot of workout, so they are functioning well. Then they could be enlarged. And after they have ceased their function, usually the normal cause is the tonsil should shrink. But quite significant numbers of population, the tonsil doesn't shrink, so it causes other problems.
I see.
So because it stays the size as it is, big, so it can cause trouble when sleeping, such as snoring. Some people have trouble with infections because when you swallow, a lot of food particle will stuck over there and causes infections. So they get fever on and off.
Okay.
And then this tonsil can also cause you to have foul smelling breath or bad breath.
I see.
These are some of the issues with this tonsils, yeah.
Okay, that's really interesting. I didn't know that tonsils, it's not just the back of your throat. You mentioned it also goes down to your neck, your ears as well, right? So I didn't know that that is actually like related.
Yes, they are all the same tissue, lymphoid tissue.
Ah,
Same
I
area,
see.
same
Same
area.
yeah. This is why it's really interesting, to come onto the show, because you learn a lot of things.
You do.
But I also do want to go back a bit to the image that was just shown on the screen. So there was actually white spots. I'm not sure if that was the right thing to address, but I think it was white spots that you have on the tonsil.
Okay,
I see a lot of people who remove those white spots on the. Is it on the palatine tonsil?
Yeah, that
usually,
is the
right?
palatine tonsil. That is what I was referring.
The whitish, yeah.
That is the exudates that can come from the tonsils. It can also be the tonsil stone. There are a lot of whitish or yellowish things that can occur in the tonsils. It could be the tonsillar crypts, it could be the follicles, or it could be the stone. And of course, exudates if it has infections in it. So the whitish thing or yellowish kind of stone, rubbery features could suggest that the tonsil has a lot of pathology in it or a lot of problems comes with it.
How does that form? Because I notice a lot of people go through removal processes for those stones that you say, right? I mean, I watch a lot of videos of such, like pimple popping videos. Okay, yes, TikToks. I watch a lot of TikToks before I go to bed, but all those pimple popping videos are quite satisfying, and these are one of the videos that I also notice people have those removal and all that.
Removal of the stone only, or is it the tonsils?
Right? I think it's the stones. It's the white stones that they remove, and always leaves behind like a hole, like a pimple on your hole. So how does that form? And
actually, these stones, they are, like I mentioned, when the tonsil is big at the back of your throat, when you swallow, a lot of food particle can be trapped into these tonsillar grooves. So when the food particle traps there, of course it be a dirty area. And when it is dirty, the next day bacteria can come and causes infection from these unhygienic areas. So this can cause you to have infection that we call tonsillitis. So in some cases, when the food particle has been there for a long time, it can form crystallized. It can be crystallized. So when this crystallized is formed, it can form stone. Like we can call it tonsil stones or tonsillolith. This is what we see it has been removed. But if you don't remove the factory of it, if you don't remove the tonsils, of course it can come back. So you just remove once, and then maybe in 3-4 days you have another one, and it will keep on coming because the main factory that produce it is the tonsil itself. That's why I don't believe that the removal of tonsils in the TikTok.
Really?
Maybe the stone itself, yes, but the removal of tonsils should be done in the operation theatre, proper surgery, and yeah.
Well, it's good to know to dispel that rumor, and also it's good to know that ARENE watches weird TikToks every night before going to bed. But other than that, because just now you mentioned that the standard procedure for the tonsil is for it to shrink after its major function has been exercised. I wonder what would make it not shrink.
All right, yeah, this is quite common. We don't actually know why 100%. Why is the reason of this person is not shrinking? But for sure, genetic plays a role. So if your family has significant history of tonsil enlargement, you have that risk of having that as well. Apart from recurrent infections, if you keep on getting infections from the tonsil, of course, the normal physiology of the tonsil is disturbed, so it won't shrink as other normal person should be. Yeah, so when it is enlarged, then it causes a lot of problem, including what we're going to talk about today, which is problem with sleeping.
Yeah.
You mentioned snoring. It is one of the spectrum. It's actually only the tip of the iceberg of sleeping problem. We have a lot of other sleeping problems, from just primary snorer until choking or not breathing during sleep, or what we call sleep apnea, obstructive sleep apnea. So there are a lot of spectrum, but of course snoring is the most common sign of sleeping problems. Yeah,
and that sounds dangerous because it seems like it's something that you.
Snoring kind of seems like an everyday.
If you don't breathe, people can go off
right?
during sleep. Yeah, that is what dangerous about this obstructive sleep apnea.
Are you saying that this can actually lead to death sometimes?
Yeah. If their respiratory center doesn't pick up that the patient or the person is not breathing, yes, they can. That is the worst complication that can occur when you have blockage during sleeping.
These are things that we don't usually think about, right? I mean, especially someone who snores, we don't usually think that it's alarming. Because snoring is like a natural effect that people usually, it occurs. Even we humans, people, females, males, we all snore.
And sometimes we make fun of it even.
Yeah, we make fun of it. It's nothing serious.
See it as a funny thing. Yeah.
Exactly. But so since we're talking about sleep apnea, and I know that there are different types of sleep apnea that we have mentioned before on our shows as well. But I do want to ask, why is it that tonsil enlargement or anything regarding tonsils is directly connected with obstructive sleep apnea instead of, does it complex sleep apnea and stuff like that?
When we talk about sleep and when we talk about blockage during sleep, it is a multifactorial thing. What I mean is there are a lot of factors. Maybe the nose contribute about 10 to 15% of the blockage. The area of the tonsil, or what we call the oropharynx, this is the most commonly affected area, and it influences a lot. I think about 60% of blockage during sleep is caused by the oropharynx region. That's why tonsil is very commonly associated with obstructive sleep apnea. And then at the bottom part of the tongue, what we call as hypopharynx, or the lingual tongue, also can cause obstruction. The epiglottis further down before the vocal cord can also cause obstruction. That could be around 10 to 15%. So like I said, 15% from the nose, mostly from the oropharynx where the tonsils are, and another 10 to 15% is down below at the lingual area or the epiglottis. So because all this area can block the air from coming in the lung, so you have to really know where is the blockage for each person. It's not everyone's the same. But the fact is 60% of the obstruction usually occur at the oropharynx area, and that is where the tonsils are located. So that's why when you have grade 4 or grade 3 tonsil, this is a large tonsils, they can block during sleep.
Yeah, I think they are also showing, as doctor is also explaining, you guys are also able to see the visual that is currently on screen
And it's not just at oropharynx, I have to emphasize as well, it's not just the tonsil is there. The palate is also there. Some people have low-lying palate. The palate is touching the tongue. When you open their mouth, you cannot see their uvula, or what we call anak tekak, the uvula.
Yes.
So that also causes choking or snoring during sleep. Apart from the size of the tongue itself, some people have large tongue. Some people have a retroflex tongue, what we call it when they sleep, the tongue slip backwards. So all this also influence the obstruction that occur for that particular patient. So that's why there are a lot of tests to identify. There are a lot of camera that you can, you know, insert to see where the obstruction for each patient. So you know, in advanced country, they have what we call a sleep endoscopy routinely done. They put the patient into the sleep, and when they snore, they put the camera to catch where is the snoring and what structure causes the snoring. Because when patient come to you, they don't snore because they are awake.
Of course.
They only snore during sleep. This is because the muscle tone is there during awake, so the airway is not collapsed. But when we sleep, the physiology changes. So the airway become negative. All the muscle tone is lost, and that's where the vibration and the obstruction occurs.
I see.
And it's really bad because we could see from the screen just
Yeah,
now
the risk
that,
of untreatment, right? Yeah, but just to also go back a little. So when you talk about snoring, so you're saying there, and you said like, okay, it's hard to say how a people is in terms of snoring, like when they're awake. But you mean there are different causes to snoring?
Yes, of course. There are a lot of causes. What I just explained was just the structural causes. Multi-level, the nose, palate, tongue, tonsil, hypopharynx. These are structures cause that can lead to snoring or obstruction. The other cause are weight, for example, the size.
Yes.
So of course, obese people, they can have a lot of fat in the neck, and this fat will cause compression when the airway is collapsed during sleep, and this can also lead to snoring and obstruction. Apart from that, lifestyle. For example, person who likes to travel, they have jet lags, who doesn't work in regular hours like shift workers. So, and now there's a concept of sleep hygiene. How do you sleep? You sleep with the lights on, with the music on? Do you really
That's
sleep?
also a factor.
That's also a factor that affects your sleep. Yeah. When I mentioned about jet lag, of course, we have our body clock that controls the regulation of the sleep. So when it is disturbed, it can also disturb the quality of sleep. And you know, we spend 1/3 of our day sleeping. So there are a lot of problems that can come when you don't sleep well.
That's true.
Yeah.
Yes, I guess those problems could relate to your, you know, cardiovascular system and also your mental health as well. And it's funny because it reminds me of a story of a friend that had a problem with snoring, and then he recently went to a doctor. And after all the tests and after all the charges that had been incurred, the final diagnosis was maybe you should lose weight. He was so angry about it. But I guess it is true that actually lifestyle and also how much weight can actually affect snoring. But I've seen sometimes, doctor, when we, you know, sometimes there are ads that come on social media. There are several contraptions that people use. There's one that they put it on the nose. I just want to check with you, is that a viable solution? And maybe you can explain to us some of the other treatments that these people with sleep apnea can use.
First of all, because the factors that causes this problem are a lot, right? So the treatment is not just one. So you really have to tailor it to each patient, because each patient comes because of different cause. For example, a thin person, no neck fat, regular working hours, not shift worker, has enlarged tonsils. And you know that is the cause of the obstruction. There's no point of you putting anything in the nose. So maybe you should remove the tonsils. For another person who has very small tonsil, but he snores badly during sleep, and when you see the neck circumference is too thick, so of course the treatment is to lose weight. For someone who has breathing problem together with snoring, and upon your examination, or he has some sinus problems, he has some allergic rhinitis that cause blockage of the nose, yes, treatment of the nose could solve his problems, including the one that is very commonly, purchased outside, like the nasal valve kind of that you stick in the bridge of the nose. And there are a lot of other things as well, as you can see, in terms of the treatment, and we need to really tailor it into each problem of the patients. So if apart from this valve, for example, you can give nasal spray to ease the congestion, and that can help you to sleep better. Apart from that, non-surgical treatment include weight loss, sleep regularly, and then if you really have to diagnose to see the severity of your sleep problem. How many times actually you choke in 1 hour, and that can only be done with a sleep study. After the sleep study has been done, you know your score, then we tailor into the treatment. Usually the treatment is combined, not just once. Lose weight and use a machine. We also have the one that you see like Darth Vader.
Yeah.
That is a CPAP machine.
That mask, breathing mask, yeah.
It's a pneumatic spleen actually. They give you air and it opens up the airway from the nose, the mouth, up until your lung. So that is the best and a very good treatment. It's a gold standard treatment for obstructive sleep apnea. Of course, when we talk about surgical treatment, when we assess the patient and we know exactly where the blockage is, of course, tonsillectomy. Some we done a surgery on the palate to widen the oropharynx area, turbinates surgeries or nasal surgeries to ease breathing problem during sleep. This can also help, but of course, it has to be tailored into each individual.
Yeah, I guess diagnosing it is very, very important. At the same time, the solution is not a one-size-fits-all solution.
No.
You really need to tailor it to your own condition.
Correct.
But even before we go to diagnosis, right? Because a lot of people, like I mentioned, for us, snoring is a normal thing.
Yep.
My dad snores,
Yeah.
and the only thing my mom does is probably wake him up, and so he stops snoring.
Yeah.
And talking about snoring and all, but really quickly before we actually move on with the show, we just want to ask doctor, what is some things that people can look out for at home itself before we actually go to the doctor that we know, okay, they has to be treated, has to be, find the diagnosis?
That is a very good point, because snoring is very common. How we know that the snoring is dangerous or not? Snoring is actually not that dangerous. What I mean is all person have some degree of snoring. Either they are loud, they are soft, but I cannot say that, after I treat you, you won't have any more snoring. Snoring is a normal physiology that can occur. But, and snore occur because there's a vibration of tissue. And there's some air still going in. So it's not too dangerous. The dangerous part is when you are quiet. And suddenly you choke and you cough, gasping for air. That is a danger sign, means that the blockage has not allowed any more air to go in. So you're silent.
So that is
silent,
one thing that we have to look out for.
Yeah, choking, coughing during sleep. Apart from snoring badly. Because snoring, it gets a lot of attention because it disturbs the people around you. But actually the main sign is when you are choking, wake up at night, gasping for air. And then other symptoms associated with it, such as you go to the loo at night time. That is because your heart is strained to compensate for the lack of oxygen. A lot of, pressure being produced in the blood. So you go to the toilet to loo. Apart from that, when you wake up, you feel tired, headache, sleepiness.
Giddy as well,
sleepiness during the day. These are some symptoms that can be looked for. Apart from that, the first main complication, which are we still have a lack of awareness about it, is high blood pressure. This is the first complication, the most common complication associated with not sleeping well. Because like I said, when you don't sleep, your oxygen is low during sleeping, your heart will pump to compensate. By right, your heart should be resting during sleep.
I think that's why regular checkup is also very, very essential. Regular checkup, every yearly checkup. That is something that you guys do have to look out for. So actually, thank you, doctor, for sharing a bit of tips. So I think now my mom knows that to look out for my dad snoring. So apart from sleeping now, you know what to do, mom. And also a lot of you as well. This is, of course, Dr. AHMAD KUSYAIRI KHALID from UITM Private Specialist Centre. Thank you so much for joining us today.